Hi, welcome everyone, and thank you for joining us today for this webinar. We don't do a lot for them specifically, moving towards inclusive social protection for gender and sexual minorities. To begin with, I would like to pay my respects to the first Australians, past and present, to the Ngunnawal people on whose traditional lands I'm speaking to you from today. These lands were never ceded, and I'd like to thank them for their persistence and patience, and for sharing their rich and long-standing culture with us all. My name is Felicity O'Brien, and I work in the social protection section in the Australian Department of Foreign Affairs and Trade. I'll be your moderator for the webinar today. So this webinar comes to you through a partnership between Australian organisation DFAT and the Department of Foreign Affairs and Trade. You'll see that we have sign language interpretation for you today and live captionings. You can click in the chat function for a fully adjustable page of captions if you need. The interpreter should be spotlighted, but if you are having problems with that, if you hover over their screen, there are 3 dots at the top and you can pin their screen. So we'll also be recording the webinar today, which will include all the slides, and this will go up on the socialprotection.org website in the following weeks and up on YouTube. The recording will be made available with Indonesian, Spanish, Bengali and French subtitles. So after our speakers today, we'll also have a question and answer session. We hope you can stick around for that. And we encourage you to share your questions to the speakers by using the Q&A option in the menu. If you wish to make comments or share links to any other useful resources that you may have, please feel free to share them here throughout the chat as well. So in this webinar today, we will be discussing issues regarding the experiences of discrimination against SOGIESC people, and this may include discussions of gender-based violence and abuse. Please reach out to a local organisation for assistance and someone to talk to if this brings up concerns for you. And for Australian-based people, there's always Lifeline Australia that you can call, and their number is 13 11 14. So please be reminded that this is a safe space for everyone today. So let's keep our questions, comments and discussions respectful, relevant and on topic. So let's get started. So marginalised people, including many with diverse sexual orientation and gender identity, expression and sex characteristics, or SOGIESC people, alternatively known as LGBTIQ+ people, have pressing social protection needs in normal times, which have been exacerbated during the COVID-19 crisis. These needs are due to the multi-layered discrimination and marginalisation that they experience in all aspects of their lives around accessing essential services, employment, health and education, even taking part in the social life of their communities. Evidence is showing us that most social protection and cash programs that have been established in response to COVID have not recognised or addressed these needs. During the COVID crisis, diverse SOGIESC civil society groups have been undertaking direct support and filling in some of the gaps. They've been doing direct service delivery and advocacy, and this has usually been undertaken without significant donor support or other funding. So as a consequence, people with diverse SOGIESC are being unequally impacted by the social health and economic aspects of the pandemic. Diversity of SOGIESC and GEDC, and the notion of leaving no one behind, is often mentioned in humanitarian and development policy and practice documents. However, this is not translating into meaningful and nuanced inclusion that is needed in practice. To ensure we reach these marginalised groups, the systemic and social marginalisation that continues to be a problem really needs to be addressed. In this webinar, we will be exploring the barriers for people with diverse SOGIESC to accessing government and non-government cash-based assistance and social protection programs, both in response to the COVID-19 crisis and also in normal times. With the newfound focus on social protection systems as the world begins recovering from the COVID-19 social, economic and health crisis, there is opportunity to ensure that we are partnering with SOGIESC civil society organisations and thinking about meaningful inclusion and taking a partnership approach. Development and humanitarian donors are being called upon to step up their efforts and walk the talk on inclusion. Emily Dwyer from EdgeEffect will be officially launching the report tonight. We don't do a lot for them specifically, moving towards inclusive social protection for gender and sexual minorities. This report was commissioned by DFAT to investigate if SOGIESC people were accessing cash-based assistance on par with the general community during the COVID crisis. Australian organisation EdgeEffect worked with civil society partners Bandhu, the Rainbow Pride Foundation and the Crisis Response Mechanism Consortium to undertake case studies in Bangladesh, Indonesia and Fiji. We will hear from these organisations on their members' experiences during these COVID times. After the webinar, you'll find the EdgeEffect report on the socialprotection.org website. We hope you will all read it and consider the recommendations in your work to adjust practice and policy so that we can really shift the dial on inclusion for SOGIESC communities. We have a really wonderful panel of speakers for you today. I'll introduce them in the order that they will be presenting and dip in and out to present them as they come onto the screen to talk to you tonight. So we're honoured to have Victor Madrigal-Borloz, the UN independent expert on sexual orientation and gender identity, joining us tonight. We'll be hearing from Emily Dwyer, the co-director of EdgeEffect, on the overview of the report. We don't do much for them specifically. From Bangladesh, we will be hearing from Shale Ahmad, from the Bandhu Social Welfare Society. From Fiji, we have Lavetanalagi Seru from the Fiji Rainbow Pride Foundation. And from Indonesia, we have Butar from CRM. We'll also have Arifin from EdgeEffect joining us to assist with translation tonight. So without further ado, I'll hand over to Emily. Thanks, Emily.
Thank you very much, Felicity. And I'll just share my screen. And also extend my thanks to everyone for joining the webinar and the launch for We Don't Do a Lot for Them specifically. I'm coming to you from Gundungara land that was also never ceded in Australia. And the title, We Don't Do a Lot for Them specifically, comes from a key informant interview we did for the report, one with a donor representative, and gives you a sense of where we may be heading. The report comes in a couple of flavours if you'd like to dig into it in more depth. There's a 4-page quick guide, but there's also a full report which goes into a lot more detail in terms of global policy and practice, some good practice examples from Uruguay and Ecuador, the more detailed country case studies that you'll hear some of tonight, and discussion and recommendations, including much more detailed recommendations for people who are actually in the business of designing, implementing and evaluating cash-based assistance programs within the broader area of social protection programs. The report will be available on socialprotection.org, also from all good, inclusive, diverse SOGIESC inclusive content repositories on the web, and also hopefully links in the chat window as well. So a couple of times already you've mentioned diversity of SOGIESC, and you might be wondering what exactly is diversity of SOGIESC. So SOGIESC stands for sexual orientation, gender identity, gender expression, and sex characteristics. So this is language which is more from the human rights world. Everyone has SOGIESC. So if you're a heterosexual person, then you have a sexual orientation. If you're someone whose birth certificate says female on it, and you understand yourself to be a woman, then you have a gender identity, just like I do as a transgender person whose birth certificate had male on it, but I just understand myself to be a woman. So everyone has SOGIESC, but it can come in many variations and all different kinds of combinations. LGBTIQ plus people, an acronym you might be more familiar with, just have diverse SOGIESC, by which we mean sexual orientations, gender identities, expressions, or sex characteristics that might currently be considered non-normative. Hopefully not forever, but at the moment. So you might ask, well, why not just say LGBTIQ? Well, there are also a whole lot of people in the world whose gender identity, whose diversity of sexual orientation and expression and other characteristics don't fit into those boxes of lesbian, gay, bi, intersex, trans, queer. And so we use SOGIESC to be more inclusive of those people, and some of which you'll hear about in the presentations tonight. For example, Hijra, people in Bangladesh, and Warrior in Indonesia. Different language and emphasis may be used by different organisations in different contexts, and sometimes for security reasons, and sometimes just because those are the issues that those organisations work on. So at times other organisations may just talk about gender diversity or talk about cultural groups. It's always good to follow the lead of local organisations when talking about those particular contexts. So my job here is just to provide a bit of an overview, I guess a bit of a sort of a global sketch of the terrain of social protection, cash-based assistance, and the situation of people with diverse SOGIESC during COVID-19. And very grateful to be joined by Victor Madrigal-Borloz to help unpack a little bit of that a little later in this introduction. And then, of course, with the country case studies, we'll go into some more detail about these issues, and we'll have a little discussion before we come up with some pretty simple steps that you can take to make your programs, your cash assistance and social protection programs more inclusive of people with diverse SOGIESC. So I'm going to start kind of backwards and just quickly run through the findings so that you know where we're going with this webinar. And then as we go through, you can sort of be thinking about the evidence that we're presenting and sort of coming up with some of your own conclusions, and hopefully a whole bunch of questions for the Q&A section in the last half hour of the webinar. So running through these relatively quickly, the first finding is that systemic discrimination, which is experienced by people with diverse SOGIESC all the time, has exacerbated the social, economic, physical, mental health impacts of COVID-19 on people with diverse SOGIESC. There have been a couple of reports, mostly that have come from within the LGBTIQ or diverse SOGIESC communities globally, and from local organisations that have made these points. And the failure to support people with diverse SOGIESC and social protection programs at this time is likely to further entrench that existing marginalisation. The second finding is that the impact of COVID-19 on people with diverse SOGIESC, despite being quite profound, seems to be fairly poorly reflected in research, planning and funding priorities of many governments and aid sector organisations in their COVID-19 work. I can't tell you how many research reports we've been through that have made no mention of people with diverse SOGIESC in terms of the economic, social or health impact of the pandemic. Looking in terms of planning, we looked at the work of a variety of donors and organisations and country contexts, and also found very little evidence of dedicated programs addressing the kinds of needs that we found. And also the funding doesn't seem to be there. And the Global Philanthropy Project has done quite an extensive study of the kind of funding which is being made available for COVID-19 programs, and has found that very little of that seems to be going directly to address issues of diversity of SOGIESC. A third finding is that unconditional cash-based assistance supported by complementary programming in areas such as livelihoods and financial capability would actually address many of the needs of people with diverse SOGIESC. Unconditional because people with diverse SOGIESC sometimes face safety issues when forced into conditional programs where they may be required to do training or work as part of receiving cash. But at the same time, often they would like to have voluntary access to those kinds of support programs. And the kind of cash can address all kinds of different issues, from helping people to meet basic needs to address the kind of psychosocial stress they might be going through, avoiding debt traps if they've taken loans in order to get through the pandemic. It helps reduce the pressure on diverse SOGIESC communities and organisations that are doing a lot of the work in the absence of government or NGO programs, and can help with social cohesion and cohesion within families. So lots of benefits of doing cash assistance well. A fourth finding is that, however, there are significant barriers for the participation of people with diverse SOGIESC in what might be regarded as universal or national cash-based assistance programs. So these programs, while described as universal, might not quite be universal, in that there are all kinds of reasons why people with diverse SOGIESC, potentially amongst other people, can't access them, which might include that they're not part of the data around which those systems are set up. They may not have access to information about the schemes. The delivery mechanisms may not be relevant or appropriate. There may be a whole bunch of other assumptions and aspects of those programs. We'll hear more about that during the webinar. A fifth finding is that government social protection programs often, social protection mechanisms often don't recognise at all or address the needs of people with diverse SOGIESC. And there's a bunch of reasons for that again we'll be addressing through the webinar. It tends to mean that in addition to universal programs which aren't accessible to people with diverse SOGIESC, there's often a lack of targeted programs, or those programs have some difficult aspects to them that we'll also hear about. The sixth finding is that aid sector programs also tend to overlook the rights, needs and strengths of people with diverse SOGIESC and overlook the gaps in the other programs which might be run by governments. And that is a lack of capability, really, amongst a lot of aid sector organisations, mean that the programs that they design and implement often indirectly discriminate against people with diverse SOGIESC because they're just not suitable for those people, or make assumptions that don't hold true for those people. A seventh finding is, I guess, the significance of informal and semi-formal protection mechanisms. So, I mean, outside of COVID context all the time, people with diverse SOGIESC help each other, often because there isn't a lot of other help available. And so that is still true with COVID-19. And so while there is a need for new support, there's also a need for this new support to work with and strengthen those informal groups, might be chosen family, people who come together in units that function as family because they don't have their legal families, or the work of civil society organisations. And a final finding that the rollout of innovations such as artificial intelligence and algorithms and other sort of aspects of digital systems can easily lead to serious risks for people with diverse SOGIESC. And so there's a need to think really carefully about how those have rolled out. So before we go to the country case studies, I'm just going to sort of sketch just a couple of things. One is, I guess, an approach to understanding the situation of people with diverse SOGIESC in crises. We'll take a little bit of a look at the ASPIRE guidelines, which are an attempt to provide some guidance to governments, and then also briefly take a look at the global policy and practice picture for people, for cash-based assistance and social protection. So the title of the report is "We Don't Do a Lot for Them Specifically," which might prompt a question, well, why should more be done specifically? And so we might consider a group of people with diverse SOGIESC who in pre-emergency times, and this could be before a conflict, it could be before a rapid onset disaster and before a pandemic, are already dealing with a whole range of issues in their lives. So it could be ostracisation from family, from their community, it might be a faith community, it might be bullying at school that leads them to leave early, it might be trouble getting a job, holding down that job, or being discriminated against in the workplace, accessing services without discrimination, living in a country with laws that criminalise aspects of their lives or don't support other aspects, and where they may be harassed walking down the street. So this is all happening before we get to the crisis, and these kinds of issues create, I guess, vulnerabilities and can reduce resilience. So a lot of people with diverse SOGIESC work in low-wage jobs, insecure, informal sector jobs, which often means they also have low levels of savings. They may be isolated from the kinds of support networks that other people have through their families and other community networks. They may not have identification documents and so can't open bank accounts or get SIM cards, or the kinds of things that often require identification, and a range of other issues that they're also dealing with before a crisis like a pandemic. And then, of course, we have COVID-19. And so those pre-emergency issues have a number of impacts. Firstly, it can mean that a pandemic like COVID-19 can have harsher consequences for people with diverse SOGIESC. So if you don't have much in the way of savings, if you work in a low-wage job in the informal sector and that disappears, that collapse of income can have pretty profound effects pretty much straight away. You may face consequences that other people do not. So, for example, in some cases, people with diverse SOGIESC are blamed for the spread of the disease just because of who they are, or as divine punishment for our sins. We sometimes might also self-exclude from aid delivery because we don't want to put ourselves in a situation where we might be exposed to discrimination, violence or harassment. We might be forced back into unsafe family homes. We might struggle to access cash. So consequences that might be specific to our identities. And then finally, we might also struggle more in recovery. May recover more slowly and maybe not to the same extent as other people. So there's that potential for existing marginalisation to be reinforced. Now, of course, it's not the whole picture. There's also support for people with diverse SOGIESC, as there is for other people. What we've seen with the pandemic globally is a lot of that is coming from informal networks. Networks of friends or people who stay together, or diverse SOGIESC civil society organisations who've done often incredible jobs with very limited funding under great stress to fill gaps and support their own communities. One of the things that we haven't seen so much of, however, is government social protection programs and cash-based assistance meeting the needs of people with diverse SOGIESC, nor aid sector social protection or cash-based assistance programs also being part of that foundation of support. Now, DFAT, as an organisation, we tend to work with aid sector organisations, humanitarian and development, in the humanitarian development space. So I'll focus my attention there, and in a moment introduce Victor Madrigal-Borloz to maybe to have a little talk about government social protection programs. But I guess the one thing to mention before we do that is that the absence of these programs is not entirely surprising. And that's because a lot of government programs outside the context of COVID-19 don't include people with diverse SOGIESC either. And a lot of aid sector programs in the humanitarian development space outside of COVID-19 also don't tend to include people with diverse SOGIESC. And so we're just going to explore that a little bit so that you have that background going into the 3 country case studies. As I said, DFAT doesn't work so much on sort of working directly with governments and the responsibilities that states have with regard to social protection. And so within the report, we were thinking, well, where can we find that kind of expertise? And we found it with the Office of the Independent Expert on Sexual Orientation and Gender Identity. It's an office with a UN mandate from the Human Rights Council to explore discrimination against violence against people with diverse sexual orientations and gender identities. And Victor Madrigal-Borloz is the mandate holder, has been since 2017. So Victor, I want to thank you for joining us and sort of coming into this webinar at this point in a sort of a Q&A kind of way. And maybe just ask you to reflect a little, now that we're kind of a couple of years into this pandemic, what strikes you most about, I guess, the kinds of experiences of people with diverse SOGIESC, maybe particularly in terms of their engagement with their governments?
Thank you very much, and good morning, good afternoon, and good evening to everyone. Thank you so much for having me. I think that well, first of all, let me commend you for the issuance of this report that you are launching today. I think it actually is signaling a new level of sophistication in the analysis of the mechanisms that are available for governments and civil society to actually continue engaging in this conversation about social inclusion and participation in pandemic response and recovery. Emily, as you know, the research of the mandate of the independent expert was originated on the fact that given that there had not been a plan for how the mandate would react during an event of this scale, it is something that actually I had not necessarily foreseen in my plans. When the pandemic happened, there was a certain perplexity in my approach in understanding exactly what it is that the mandate was supposed to do. Very luckily, I rely on an extremely well-articulated and empowered movement And so I reached out and carried out a consultation that was actually quite extended. And the conclusions, I think, is that events of this nature present a magnifying glass into dynamics of violence and discrimination that are present there all the time, but are exacerbated in a way that provide specific data about how exclusion and mechanisms of violence manifest themselves. One example of hundreds, reliance on community leaders to distribute survival food and health packages. When those community leaders are themselves replicating structures of discrimination and will say to people, oh, this family package will not be delivered to you because yours is not a proper family. That is a glimpse of the type of state responsibility in not providing clear and appropriate preventive action throughout the design of measures. Emily.
Now, thanks, Victor. We're used to, or those of us who sort of engage with the global human rights system are used to independent experts and special rapporteurs issuing fairly sort of technical human rights reports in fairly technical language and putting out statements and the like. You've done something a little different in creating something called the Aspire guidelines, which are up on the screen at the moment. There are sort of 6 guidelines under that, fitting the name for something that starts with all the letters. But in any case, why did you take this step? It's a little odd.
It was very much the result of that consultative process, Emily. 500 individuals reporting from 75 countries, the reading of 80 reports that had been issued up until June of last year when I actually issued the guidelines persuaded me that there was a very clear lack of just a very basic framework of reference that would remind states of the need to ensure certain minimum aspects in the participation of persons in this type of approaches and the insertion of these approaches into the larger context of how do you do pandemic response and recovery that is efficient and effective. My basic conclusion is that to this, it is crucial to have a human rights-based approach through a framework that actually ensures equality and non-discrimination, participation, indivisibility, empowerment, and accountability. And all of these elements, which are clear legal references of state responsibility, this is very important. This is not aspirational language. This is what states are committed to through the international human rights law framework, translate themselves into a number of things that can be very practical about how, for example, when designing a process of response, you need to ensure that you ask people, is it appropriate that the measure be designed in X or Y way for the particular needs and realities of your communities? The Aspire framework, as you know, is, I believe, I'm also a little bit doubtful, Emily, but I will attempt that it's an acronym. Is that perhaps the right word in English? Actually reflecting the letters of acknowledgement of the existence of LGBT people, support to LGBT serving and LGBT-led organizations, protection of their needs, remembering that indirect discrimination is a real risk that need to be brought on forward. I had many examples of that occurring, representation being key as a matter of ensuring efficiency and effectiveness. And finally, Emily, what you have contributed so substantively about, and I really want to acknowledge the work in this excellent report that you're launching today, is that evidence-based approaches are the only way to go. Otherwise, we will be designing frameworks based on prejudice and stigma, and therefore failing to respond effectively to the needs of the population.
Thank you for those generous comments. Maybe sort of one quick question. You're very generously staying with us through the webinar, and so if people do have questions in particular around state responsibility, you could drop those into the Q&A. But of course, there are many different governments, some of which are increasingly supportive of people with diverse SOGIESC, some of which are maybe sort of sitting in the middle, and others that may sort of edge toward being hostile at times. So do you have a sense of, I guess, the role of the guidelines in contexts where maybe there is that passivity or even hostility? How do you see them working?
Thank you, Emily. That's a really important question. I think what I learned during the pandemic is that there is a certain commonality with other situations of emergency and disaster. I think we must bear in mind that all of this response is placed in a larger framework, which is the framework of emergency powers granted to address not only a pandemic, but other situations of emergency. And although we may have thought that this situation was absolutely novel and that it allowed states to actually have a completely untested grounds, I found that the framework of emergencies that determines, of course, that measures must be necessary to combat the particular crisis that is related, and that they need to be reasonable and proportionate. They need to last only as long as they are so necessary, and proportional is one of the elements that I would call very much as a part of this framework that also kind of allows that we address this legally with states that are hostile and maybe using the pandemic as an excuse to persecute LGBT people, as I am on the record as stating in relation to, for example, selective raids in Uganda, or specifically targeting legislation with no connection to public health in Hungary. And on the other hand, providing states with the tools to just be aware, because as you say, it might be that measures are not being designed with a discriminatory purpose, but somehow they will deploy in some cases discriminatory impact, such as, just to give one example of many, the so-called gender-based curfews in certain Latin American countries that basically eliminated the possibility for gender diverse and trans persons to access basic health and other survival facilities simply because they would not fit neatly into the binary mold that was at the origin of the design of the measure. So I think awareness is a fundamental element as to why these guidelines were created, and hopefully the implementation of the framework is just the use of a very pragmatic way of simply remembering which kind of checklist you need to go through when one designs one's processes of response and recovery.
Thank you. And thanks so much for joining the webinar. You bring a huge depth of experience and consultation around these issues. So if you do have questions on state responsibility, please drop them in the Q&A. I'm just going to, before we get to the case studies.
I'm delighted and thankful to be here.
Yeah. Before we get to the country case studies, I'm just going to really quickly take a look at sort of global policy and practice. A lot of in most cases, we didn't find mention of people with diverse SOGIESC or LGBTIQ people within planning documents. So one that does is OCHA's Global Humanitarian Response Plan, which does note the challenges of disconnection from networks, health issues, issues with gender-based violence and so forth. But then when we looked at the kinds of programs, we looked for programs involving people with diverse SOGIESC, we didn't find very many. For example, in the Global Gender Response Tracker, as mentioned, the Global Philanthropy Project hasn't found much in the way of funding for programs addressing the kinds of risks which are mentioned in the OCHA Global Humanitarian Response Plan. And we interviewed people from the aid sector about the ways in which people with diverse SOGIESC are included, or what maybe some of the barriers are. And some of it is that lack of evidence, which, for example, one organisation mentioned didn't look at the intersections of GBV and cash-based programming for people with diverse SOGIESC. Others pointed out that there's not a sense, there's not an understanding, there's not that specific issues exist and might require specific programming. For some organisations, questions of sensitivity of their own staff or partners. And another that, and this is indeed the quote that led to the naming of the report, that gender equality and social inclusion programs often include women and girls, sometimes people with disabilities, and then kind of stop. And then for other groups, it's often fairly thin pickings. Looking at existing social protection and cash policy and practice, we didn't find any example of policy and practice guidance that you could say systematically works across the program cycle. There were bits and pieces here and there, but nothing that would really help an organisation implement a whole program. The research that we looked at in terms of the social and economic impacts frequently didn't mention or substantively address issues of diversity of SOGIESC. That includes gender-focused research that often is inherently heteronormative and doesn't recognise trans or gender non-binary people. LGBTIQ often just gets tacked on to the end of long lists. And often it seems that organisations have a very limited capability to work on diverse SOGIESC issues. And so the consequences of a lack of systematic guidance are actually fairly profound when they come to try to do work in this space, or indeed often don't. There's one example that I just want to share with you, the multi-agency operational guidance and toolkit for multi-purpose cash, which on the face of it looks pretty good. So it does mention LGBTI individuals may be better placed receiving cash than in-kind assistance. It means they maybe don't have to go somewhere to collect that. And advises engagement with individuals, including people with diverse gender identities, and also to consider LGBTIQ households alongside other non-normative households. And so you might be wondering, well, what problem do they have with this? This is actually looks fairly good. And I guess the challenge that we see even here is that in being advised to engage with individuals with diverse gender identity, if an organisation hasn't ever done it before, if they haven't trained their staff to do it, if they haven't adapted their engagement tools to do it safely, if they don't know how to do a risk assessment because they haven't developed the partnerships or don't have a good understanding of the situation, then what does it mean to engage? What would you ask? And what would you even do with information that you received if you did ask? And the same with consideration of households. We'll consider them in what way? Or do you, if you're going to include that within a gender age and diversity analysis, does your organisation's analysis tool actually allow you to do that? Have you had experience doing it? Do you have the partnerships to do it? Do you have the training to do it? So there needs to be both, from our perspective, much more detailed guidance, but also a transformation within the capabilities of humanitarian and development sector organisations. And the absence of that capability within the humanitarian development sector can lead to some pretty profound challenges. So just to take a look at a couple more specifically in terms of cash-based programming. In terms of targeting criteria, proxy means tests or poverty indicators might not be a particularly good way of understanding the vulnerability of people with diverse SOGIESC, who may also not sort of come up in household data or surveys or algorithms, which if they're used to target people with diverse SOGIESC, won't include them if the data doesn't include people with diverse SOGIESC. You might need to simplify or waive some of the selection criteria. You might need to work with diverse SOGIESC CSOs themselves in order to target communities which are hard to reach and which won't identify themselves because they've got pretty good reasons not to in a lot of countries. And also targeted programs are sometimes raise risks for people with diverse SOGIESC because other people might feel like they're getting special treatment. So just on that sort of one issue of targeting, of a whole range of those issues, more specifically about cash-based assistance, there are lots of issues to be aware of. There are recommendations in the full report that go into detail in each of these areas in a way that we won't be able to go into in this webinar. And I will just throw this up briefly before handing back to you, Felicity. We do, as well as sort of more specific guidance around cash-based and social protection programming, there is also a need for organisations to transform themselves to be able to move from being essentially unaware or inactive in this space to more inclusive and transformative, to ameliorate the impacts of norms which underlie the violence and discrimination that people with diverse SOGIESC experience, but also challenge those norms where that's possible. So Felicity, I'll hand it back to you. I know they've been probably really looking forward to the country case studies, and hopefully this has been a sort of provided a bit of a sort of a sketch of the terrain within which you will now be able to sort of place some of these experiences from the three countries. Thank you.
Great, thanks Emily, and thanks Victor too. We're going to move on to our country case studies now. So first of all, we're going to hear from Shale Ahmad from the Bandhu Social Welfare Society in Bangladesh. Take it away, Shale.
Yeah, thank you. Thank you so much, Felicity, for introducing me as well as, Bandhu. And I would like to express my sincere thanks, to AIDS-Effect as well as DFAT, for giving us opportunity to participate in this very interesting, study. So this evening, I'm going to share you very briefly about, the diverse SOGI context in Bangladesh. I will also share you briefly about issues during COVID-19, crisis that particularly the communities, has been suffering. Also, challenged by the community for accessing, the support, as well as, a couple of recommendations, and perhaps, there are some possible steps we may take, to improve the situation. So, yeah, in terms of, the context, overall, the SOGI context in Bangladesh, we actually, do not have any anti-discriminatory legislation to support the different aspects of, SOGI population. And there are, criminalization under colonial era still, sort of, we are hosting in Bangladesh with other punitive laws. In 2018, the government of Bangladesh introduced Digital Security Act, and through this act, there are targeted, sort of surveillance in terms of policies and, different issues, which includes, the SOGI population are also thinking of is a risk, to expose themselves. We have extensive level of, stigma and exclusion, from the mainstream society, and there are, of course, various level of stigma, discrimination in society, workplace, healthcare, and education sectors. Even though we are working with number of medias, but sometimes we see that there are very sort of negative media representation about the overall SOGI population. Even there are some positive reports. Sometimes the media people are writing in relation to hijras and trans women population. And of course, there are continuous threat, from the extremist, groups, towards SOGI population. Next slide, please. Yeah, in relation to issues around, particularly the SOGI population faces during the COVID-19 crisis, there are big drop in income and ability to meet, daily basic needs of that, community people. Forced migration to the family due to financial crisis and leading to increase in domestic gender-based and gender expression-based violence, as Emily just mentioned. There are also level of mental health impact of the community people, and therefore the significant level of suicide tendencies, trauma we have noticed during that COVID crisis. There are lack of access to medical treatment and vaccinations as well, because community people sometimes cannot access the government testing facilities, and the private facilities are very, very expensive, and people just cannot access their support. Next slide, please. Yeah, so in terms of the challenge for accessing the existing support from different sectors, very often the transgender population are left off list for aid distributed by the local officials, and both of the government and most NGO program are completely Hijra focused, while leaving the other people with diverse SOGI without support. The government promise or government distributed support are relatively ad hoc basis that is not sort of meeting the real sort of needs of the community people. And most importantly, the transgender population, they actually need a national ID ID card to open the bank accounts, which they are lacking. Some of them they have, but there are also different stories in terms of having the national ID cards, and also low level of sort of mobile phone ownership hinders use to mobile cash, because you have to have mobile phone to receive the cash support. So next slide, please. Yeah, what steps can be taken in terms of improve the situation? What we are thinking, we have to have, I think, financial training program for Hijras and other people with diverse SOGI population. Not only the community, but at the same time, a significant level of training provision is also needed, for service provider and key institutions like banks and other agencies in terms of make them sort of sensitized about issues around the issues, needs, and the particular reality of that communities are suffering. More advocacy is required in terms of people to able to get to receive national ID documents in their own sort of gender, so that they can use a bank account. And need for the cash-based assistance strongly. I would like to recommend for that, so that and also we have to advocate for not to have rely on the mobile to access to receive cash-based assistance. And also, greater level advocacy is required in terms of legal and societal reform to end discrimination and harassment. And more importantly, I would like to end sharing you that we have to have even national level advocacy in terms of making our national social protection policies to more inclusive, not only Hijra and trans women focus, but so if we to include the other SOGI population, so that people will have opportunity to access the government support as well. So with that note, I would like to end here, and happy to respond to any question that you may have. Over to Emily, please. Thank you for hearing me.
Thanks, Shale. It was great to hear your perspectives on the report. We will now hear from Lavetanalagi Seru from the Rainbow Pride Foundation in Fiji.
Good evening, everyone. I have the greatest pleasure to be presenting the findings from Fiji this evening. Just a disclaimer that I am not an employee with the Rainbow Pride Foundation, but was heavily involved in the research in Fiji late last year. I will begin by talking about what are some of the needs that is highlighted in this report. And if you can move to the next slide, please. One of the greatest needs right now, especially with COVID-19, but also with tropical cyclones that have impacted Fiji, is around economic recovery and rehabilitation at individual and at household level. Many persons of diverse SOGIESC shared that they still do not get access or support, while increasingly LGBTQI community members have lost their homes in the disasters, have lost their jobs during COVID-19. Most of the LGBTQI community members work in the tourism and service sector industries and also in informal sectors. And as a result of losing jobs, many LGBTQI community members are forced to leave their rented homes, which have been their safe havens away from their families and relatives who have stigmatized and discriminated them. They are also often excluded from livelihood and economic support and other programs because of the blanketed approach that does not really get to target them. Secondly, during and post disasters, we are increasingly seeing the number of LGBTQI individuals who are seeking mental health and psychosocial support because of not only the trauma from the disaster itself, but also from experiences of poverty, anxiety and helplessness, violence and discrimination. The Delta variant has brought about prolonged lockdowns with increasing number of positive cases and deaths here in Fiji, which has further challenged accessibility for support for community members. Their risk with accessing cash transfers from outlets such as Vodafone, the risk of contracting the virus and bringing it back home, and for many, purchasing masks and hand sanitizers are a luxury. In terms of what the LGBTQI community are using this cash aid support for, it is supporting both the individual and the collective, so their families and friends as well. They're being able to purchase basic food items and meet other household needs. It has also enabled many community members to settle accumulating debts, pay off overdue rent, bills, and higher purchases that have accumulated ever since when they lost their jobs. As a result of this, it has reduced some levels of pressure, worry, and anxiety. There are some who have also utilized these cash transfers to set up small businesses, such as small canteens and vegetable roadside markets. Another positive impact that cash transfers has had on the LGBTQI community is that it has led to some degree of change in power relations at household and also at communal level. As a result of the individuals contributing to their family and also to the community, they have leveraged this, and community and the families as well have allowed them to be part of decision making, and this has also strengthened social kinships. Finally, most of the LGBTQI community in a communal way, are using the support that they're receiving to reach out and support others within the wider community, including sex workers, street boys, and the elderly. Next slide, please. Sorry, if you can go back to the slide before. Oh, yeah. So in terms of the limitations, in terms of the limitation, despite the fact that Fiji has one of the progressive constitutional protections for persons of diverse SOGI, there's still a lack of coherence between policy and practice. Many LGBTQI are still being stigmatized, ostracized, and discriminated, and excluded from accessing disaster aid and support, even as far as being vilified for their, on the basis of their SOGI. In some of the offices, government offices that they're seeking support from, they're made to self-question their gender identities in front of public. So these are some of the negative experiences that they have received. For the LGBTQI community, one of the barriers has to also do with access to information for support. Unless you have a phone, then you're able to access information. Some don't have any, or some had the unfortunate experience to butter off their phone in order to put food on the table. Another barrier to accessing government support is the bureaucracy. And applicants have shared that they need birth certificate, which cost around $15, and the government has just removed that. But back last year, this was equivalent to at least 3 decent meals for a family of 3. They need to get a voter ID, registered SIM cards, pay for their fares, and they are not guaranteed on whether their application will be successful to receiving support. So they have to make this decision of either putting food on the table or go through the bureaucratic process to access that support. The limited capacity on SOGIESC and lack of data and information available is also one of the barriers. The lack of data collection tools and policies in place to ensure SOGIESC inclusive practices remains to be a barrier for both government and also for CSOs and other non-state actors. One of the staff of an organization shared that since their donor hadn't asked for them to report on how they're engaging people of diverse SOGIESC in their programs, there hasn't been any effort to target and capture the LGBTQI community. And so they, very much still using a very blanketed approach. Even as humanitarians who are going out into communities, they are struggling with identifying LGBTQI, and even approaching them in a way that they do not bring further harm. Next slide, please. So why is it important to work with LGBTQI CSOs? Yeah. Following the tropical cyclone Harold and Yasa last year, and during this COVID-19 pandemic, organizations such as the Rainbow Pride Foundation, despite the limited resources, have been at the forefront providing technical support and guidance to ensure SOGIESC inclusion, including working through the Australian Humanitarian Partnership and also the cluster system, such as the Safety and Protection Cluster. The organization has also connected this humanitarian organization with LGBTQI networks and communities on the ground and even provided volunteers. The organization, through its hubs, have disseminated information, including through social media chat groups, so that LGBTQI individuals and communities are kept informed of both government and CSO support. Additionally, many community members shared how they felt comfortable accessing aid and support from CSOs rather than government. And the factors include the much more favorable experience around safety, confidentiality, and lessened experience of stigma and discrimination, and also the lessened bureaucracy. Finally, through working with LGBTQI CSOs, humanitarian actors are able to increase their coverage, including in rural, remote, and maritime areas, where LGBTQI community members are often not visible, especially in a traditional setting. LGBTQI organizations have the networks, the database, and have delivered trainings that can support humanitarian actors in the efforts of leaving no one behind. Last slide, please. Finally, learning from the cash-based transfer rollout led by Save the Children late last year, this was the result of the cash and voucher assessment that Save the Children had carried out, findings which highlighted that LGBTQI was one of those vulnerable communities during times of disasters and are often left out. They reached out to RPF, who provided the technical support and guidance on how to target LGBTQI beneficiaries. And so, it is therefore critical to involve LGBTQI organizations in the design of such interventions, especially as you are, considering designing data collection tools, as you're beginning to train data collectors on how they will, frame and ask questions on SOGIESC, and also exploring the ways of working and approaches so that, they uphold the principle of do no harm. We have seen, from the work between Save the Children and RPF, that it has also opened the door to, reaching out to other vulnerable and often marginalized groups, such as sex workers and street dwellers, who have their own networks and often hard to reach, especially sex workers. There are, a lot of opportunities for collaboration between government, CSO, and LGBTQI organizations to help, deepen the analysis on how communities are affected differently and how targeted approaches can become effective and efficient in humanitarian response, including cash-based interventions. There's still a great need for capacity strengthening, resource and information sharing, especially for a subject that does not have a lot of available literature here in the Pacific, development of data collection tools, moving from a very binary and heteronormative lens to one of diverse SOGIESC. And finally, for large donor organizations such as DFAT and other INGOs, we want to see more of that push from a top-down approach on SOGIESC inclusion being mainstream in its programs and policies so that it can push the downstream partners to become more SOGIESC inclusive in policy, programs, and practice. Thank you for your attention, and I look forward to answering any questions. Naka.
Thanks, Lagi, for the Fijian perspective there. Just a reminder, everyone, to get any questions that you might have for the panelists tonight into the Q&A box. Be great to see some questions coming through shortly. We've got our last country case study speaker now, and I'd like to pass over to Butar from CRM in Indonesia.
Yeah, thank you, Felicity, and also I would like to say thank you to SFAC and also DFAT, of course, to have involved us in this research. So a little bit about the crisis response mechanism is the national response that we have a 5 members organization that Arus Pelangi and also Gewel Ina, Sanggar Suara, and Community Legal Aid or LBHM, and also the UNAIDS Indonesia that focus to resource mobilizations to response and to prevention the crisis against LGBT peoples in Indonesia. Next slide, please. And if we want to discuss how the situations of the sexual and gender minority people during the pandemic COVID-19, I think we cannot separate these situations before the pandemic COVID-19 in Indonesia. At least since 2016, there is the crackdown of LGBT issues occurred in Indonesia. And since that years, we have been facing institutional homophobia, and this crackdown also were indicated several things. For instance, the Indonesian government and fundamentalism religion has been trying to criminalize the sexual and gender minority people through the revision of the criminal code bills. And also there is a draft of family resilience bills. That's this bill is it's kind of institutional conversion therapy for the LGBT peoples in Indonesia. And because of that, since that years, the cases against sexual and gender minority in Indonesia significantly increased, such as persecutions and discriminations, and also limited access to social protections. And then how the situations when the COVID-19 happened in Indonesia, of course, there is a new layer and a new aspect of crisis that facing of the LGBT peoples in Indonesia. Because before the pandemic COVID-19, LGBT people has been putting in the crisis situation too. But when the COVID-19 happened, there is a new crisis. At least from this research that we found 3 aspects that what the impact of the COVID-19 to sexual and gender minority. And the first impact is about the economic impact, because this is really it's really impactful, because mostly the sexual and gender minority people decrease the income, because in Indonesia, the majority of us working the sector, the vulnerable of COVID-19 transmissions, such as sex workers and street singer, and also driver for online transportation such as Uber, Grab, and also Gojek, and also in the salon, beauty salon service. Because of that, all of those sector is really vulnerable for the transmission of COVID-19. In this research, we found 62% of LGBT people faced running out of food and also not able to paying the rent and other bills, and also failure of their small business. And then the second thing is about the health impact. 88% of this community experience mental health impact, including stress, because we are living in unsafe space. And also we feel loneliness and also difficulties accessing psychosocial services. Yeah, because the reason is we have no money, because our income is decreased significantly. And also about the health issues, some of our Waria's friends, Waria is the terminology for the trans women in Indonesia, cannot continue the hormonal treatment because they have no money to buy the hormones. And the last impact also about the social impact. In the pandemic situations, violence and discrimination also still happening for the sexual and gender minority people in Indonesia. At least since last year until last month, crisis response mechanism received 42 cases. That cases, very various cases, start from the sweeping and also expulsions until a murder to LGBT and also to trans women or waria in Indonesia. Based on another research that conducted by CRM, so more than 50% sexual and gender minority in Indonesia didn't receive the assistance from the government because, yeah, we know, because the classic reasons such as no ID card and also non-prioritizing, and also of course about the experience, the discriminations based on the SOGIESC. But I think both of those situations before and also during the pandemic that make there is the multidimensional crisis that happened toward LGBT peoples in Indonesia. But I think the statistic that I mentioned before don't really tell you about the actual experience of people, right? So I will share you one story how the multidimensional crisis work to us. This is a story from the Angel. Her name is Angel. She is one of the warriors in Jakarta, the capital city of Indonesia. Angel is a trans woman sex workers, and we found died in her rent house last month because she ran away from her house since she very young age. Hence, because of that, she has no ID card, there is no health insurance, and because of that, she worked as a sex worker in Jakarta, and she is often raped by the police for working as a sex worker, and in and out jail and rehabilitation unit in Jakarta. It's become her daily life as a sex worker and as a trans women persons. And during the pandemic, from the information that we get, she still worked as a sex worker, and because she didn't get a support from our government. And also another information that we found, she also HIV positive because, and she never get a treatment for the ARV, and also there is no another treatment, and it's make her situation is worse. And in the last things when she died, the funeral process also really difficult for us to find the place for her funeral, because she is considered as a Mr. X or abandoned persons because she has no ID card. So I think the story of Angel can representing how the situation of LGBT people in Indonesia in during the COVID-19 and how the multidimensional crisis work to us in this country. And next slide, please. And how about the government programs related to the social protection programs? Of course, I think Indonesia is one of the countries that has many social protection programs. We have such as Kartu Prakerja, we have BLT, I don't know in English. BLT is like direct case assistance, and also we have also like program Keluarga Harapan is for the family, but yeah, of course the binary family and heterosexual family. But the fact is, all of this program has a problem, especially when that implementing to the sexual and gender minority groups. In this research, we identified several challenging and several problems related to the program, related to this, related to the programs. Like to access all those programs, you need the ID card. But you know, ID card is the fundamental problems in LGBT people in Indonesia, especially for the trans women people. So of course, if you have no ID card, you cannot access this assistance. And also another problems is about the sexual and gender minority people also was excluded from this several program. For instance, in the National Action Plan for Human Rights, from the vulnerable group that is a target in this program, there is no LGBT community. So I think this is the fundamental reasons when you excluded from the human right agenda in your country, so you cannot access. You have a limited access to the another programs, I think. And also another problem is about the data. Exactly, when you're trying to access the assistance, they need your data. This is really dilemmatic for us because there is no guarantee this data will be secure, especially in these current situations. The Indonesian have planning to revisions the criminal code that criminalize us. So I think it's make the feel scary to access the assistance because your data is not safe. And also about the some of the programs and assistance are also irrelevant for the LGBT situations, because I think there is no assessment for what they really need the sexual and gender minority people need. Because of that, mostly the assistance we're given is irrelevant. For example, the gifts sewing machines to the warriors, sometimes it's not useful, right? Because mostly the warrior live in the small rent house and there is no place to place the machines. And of course, not all warrior have a capacity and interesting to use the machines. Because of that, the machine sometimes they will sell it back to get the cash, to get the money. So this is the many problems about the governance problem related to the social protection in Indonesia. And next, please. And because of those problems that I explained before, we must survive through collective effort. Why? Because we need still survive in this country. Because of that, we just have one choice to survive with our collective effort to still alive in the crisis situations. So because of that, several response that we conducted as a community and CSO to respond to persecution, social economic issues such as poverty and hunger, especially in COVID-19 situation. The example response that we conducted is, since March 2020, crisis response mechanism has been collecting public donation for COVID-19 response. That donation have distributed to around 3,500 for LGBT people in 20 provinces in Indonesia. We distributed the cash, care package, and also some of initiative from another LGBT organization. The collective has been trying to make the collective kitchen to cooking together to survive together in this COVID-19 situation. And of course, this initiative, this effort is trying to filling the gap left behind government programs that not reach our community. And the reason because of the security issues and also about our data, and also this response and this case and this assistance more accessible for us, because this is based on our need, and also this is conducted by our collective and among our collective, and we know really better what we need. So this is what we conducted in the crisis situations. And next slide. But because from all that I explained before, what should we do to respond to this crisis? In this moment, as a CSO, we need to continue a lot of things, and we have a recommendation for all of you to respond to these situations. And firstly, we, especially me and we from this crisis response mechanism, totally agreed with Aspire's statement, that guideline that already explains Emily before. But in Indonesia also, we have a recommendation that in line with the Aspire, which we call a BOLD. What the BOLD? The B is a build. So we need your support and contribution to build the enabling environment for the sexual and gender minority community people in Indonesia, based on your focus and also your expertise and your organization expertise as well. And also, organize. And this support is not stopped just in you, but we hope you also can help us to organize and to gain any support from another people and around the world and organization for this situation, especially to stop the plan of decriminalizations of LGBT peoples in Indonesia, to tackle the plan about the several bills, several policy that trying to criminalize, that trying to conversion therapy in LGBT peoples in Indonesia. And the last is L, lead. So when you are the donor organizations and you have the program for the LGBT people in our country, this time we beg to you, please, the lead of this program is us, is the sexual and gender minority community organization too, because several programs are related to LGBT people in Indonesia. It's not LGBT lead. I think this is very it's very not a good situation for us, because this is really important, right? Because it's time for us to reclaiming our space. We realize that a lot challenging when you work with the grassroots organizations such as LGBT organization. But I think we all know participatory and community lead is the core value for the social change. Because of that, if you have a programs in Indonesia about LGBT, please give it to us to lead the programs. And the last recommendation from us is defend. This is really also important. The last is we will to say to all of our allies in these virtual rooms, when times are getting worse for us here, that we need you to still stay with us and also to show your solidarity with us. Because I think we defend together to face the crisis situations. Yeah, I think this is a little bit from the Indonesians. Before I closing the presentation, we have the short animation video that show you the comprehensive how the COVID-19 impact to LGBT people in Indonesia. And yeah, thank you and enjoy the video. Thank you, Felicity.
Thank you very much, Hichon. We've run out of time to show the video. Sorry, everyone. But if you have a look in the chat screen, there's a link to it there, so you can have a look at it in your own time. And it's a great little advocacy video that CRM have put together. I recommend having a look at it. Now I'd like to hand back to Emily for some closing statements. And please, if you do have any questions, get them in the Q&A box. And after Emily's made her closing remarks, we'll quickly move on to the Q&A session. Thanks, Emily.
Thanks very much, Felicity. So just really quickly mention a couple of discussion points. There's more on each of these in the report, so I won't go into a great deal of detail. You've heard that there's quite a lot of diversity within diverse SOGIESC groups and a need for any assessments which are done to recognise that. And the programs maybe need to be planned to recognise that as well. I've already talked about targeting and universality during this webinar. In terms of delivery, accessibility and financial inclusion, you've heard that people often don't have mobile phones, they don't have bank accounts. Often direct cash is sometimes still needed. Because that's the only way that people can get cash because they don't have ID documents and so forth. There's a real support within the community for Cash Plus or complementary programs that mix cash with other kinds of support, but only if they're unconditional. So people don't want to be forced into positions where they may be in training or work situations that are unsafe or inappropriate for them. And those programs also need to target not just LGBTIQ people, but people who might be discriminating against them within the cash social protection systems. We've talked about the need to support existing informal and semi-formal mechanisms. There was a question on data digitalisation and artificial intelligence, which I'll quickly try to answer as we go. Which is some of the key issues are that if you're relying upon databases that don't include with people with diverse SOGIESC, and you're using algorithms with those, then it's not going to include people diverse SOGIESC. A lot of the algorithms that are written in some of these systems make assumptions about who constitutes a household. And so those algorithms need to be interrogated very carefully, because once they're in the black boxes of these systems, that they can be very hard to get rid of. There's also questions about the risk of data collection, the know your customer requirements for getting SIM cards, who has access to this data, especially when it's being shared with other people in the cash-based assistance chain. And also concern about biometrics, which are being used with some cash assistance programs, for example, facial recognition, which could out a transgender person, for example. So there's lots of data risk issues, and there needs to be data risk assessments. And then finally, there's a need for donors to get on the front foot here and make it clear that there is an expectation that programs do include people with diverse SOGIESC. There are 5 steps in the report for making social protection more inclusive, including adopting the ASPIRE guidelines and norms-based approaches, doing further research, partnering with CSOs and supporting them. There are risks for CSOs to be involved in this work. They're not cash-based assistance expert organisations, and so there is a need for capacity building and longer-term CSO strengthening and understanding of the potential sort of conflicts that come up in communities. In terms of inclusive cash, an understanding about how indirect discrimination often happens, how to design programs so that that doesn't happen, supporting diverse SOGIESC CSOs to fill the gaps, and respecting their role as intermediaries with communities, making sure that complementary programming is there, and getting advice, especially when introducing new issues. 4 reports there. And if there are any remaining questions, ask away.
Thanks, Emily. I have 2 questions here. The first one is, and we might ask Victor for his views on this one too, but we're keen to hear about the role that national human rights institutions have played or could play in supporting SOGIESC communities during the pandemic. It'd be great to also hear from the panelists briefly on where they've seen human rights institutions step in to address needs during this time too. Thanks.
Thank you very much, Felicity. Is it okay that I jump in now?
Yes, please.
Thank you very much. It's a great question because, of course, what I think has been happening in relation to the pandemic is an understanding that we need to be resourceful in understanding how different frameworks and different institutionalities can contribute to the solution. National human rights institutions in several countries have actually been a key meeting point between civil society and other state structures. Let's remember that national human rights institutions have this extraordinary trait of actually being non-governmental state organizations. So in a matter of fact, they are able to actually create the meeting point. In my experience, in those countries where the National Human Rights Institution has been mindful of creating a network within civil society, very quickly they were able to gather, amplify, and provide really a texture to the response of the state. I can give you several examples of national human rights institutions that ensured that LGBT and gender diverse persons were present in tables where measures were being designed. And most importantly, they put in the frameworks for ensuring that LGBT and gender diverse persons were present in the frameworks of monitoring and evaluation of the impact of the response. And this knowledge that of course is available to national human rights institutions when they have the research capacities to process data, something fantastically important that Emily was making reference to, and that I think has been part of their substantial contribution in this equation. Felicity and Emily and other colleagues in the panel, I'll probably need to step out in just a second. So just to say how delighted and grateful I am and how much I hope that we continue in this conversation. Please know, all of you around the chat, that you all have the support of the mandate of the independent expert. We will continue working on this, and thank you so much for having me here today.
Thank you so much for joining us, Victor. We really appreciate it. We know the timing wasn't great for you, so much appreciated. See you later. I don't know if anyone else wants to answer that question as well, or maybe I can move on to the next question. Emily, did you have anything you wanted to add about the human rights institutions playing a role, or would you like me to move on to the next question?
Nothing specifically on that. I do see that there's one question on data and what to do in needs assessments, and I could say something briefly about that.
Oh yeah, sure, great. That would be wonderful.
There is in the report a short section about how to collect data in ways which are safe, inclusive, and effective. Probably the best guidance on this globally is from the Williams Institute. But I think one of the cautions is that a lot of the guidance on data collection has been developed in sort of global north or high-income countries, which are more accepting of people with diverse SOGIESC and in health and sort of service delivery contexts in those countries. So all of it will need to be heavily contextualized to work in the different countries and contexts which you're working in. There are a series of rules of thumb, which are, I forget on which page of the report, but which I guess details some of our experiences in data collection and ways to make it safe and effective. You don't want to sort of just collect data for the sake of it. Having an other box doesn't really help you do anything with that kind of data. So there needs to be a plan for what you want to do with the data, how you might work with a diverse SOGIESC CSO to work out what kind of data needs to be collected, how it can be collected safely, maybe consider using peer researchers and storytelling and qualitative methods rather than quantitative methods. There's often a pressure to know how many people are here or there, but often collecting data about individuals and numbers of people is unsafe and quite difficult. And it's enough often to understand what the contours of the kinds of experiences are, and then to use that to design programs that are more accessible. So there's some guidance, very general guidance in the report, but this is certainly an area where there needs to be a lot more support. We don't have something like the Washington questions for people with diverse SOGIESC, so there's no sort of standardized approach. And there isn't a lot of really good guidance out there, so someone should create it.
Thank you, Emily. I think we have time for maybe 2 more quick questions. I might go to this one from Liz. It says, thanks so much. I'd like to hear more advice on how we can get the right balance to get appropriate targeted humanitarian cash assistance responses and social protection schemes in place in a way that is safe and does no harm, but also doesn't continue to put too much of a burden on the CSO organisations representing the SOGIESC communities, which have been filling the gap in the meantime. Lucky, would you like to answer that one for us?
Sure, thank you.
Thank you.
Yeah, so I guess most of the other panel speakers, as well as Emily has alluded to this earlier, you'll need to consult. I think consult is a very important word. You need to consult with LGBTQI organizations in the ground. Find someone or find an organization and consult with them. They're able to provide, rich experiences that can inform any intervention when it comes to disaster response in general. And what Emily just shared a few minutes ago about, the technical guidance, it needs to be contextualized. So only by approaching the LGBTQ organization, you'll be able to get that feedback. The other is, I think from the case study here in Fiji, and this was something that came up often with the organization that we were involving in the key informant interviews, was that there's a great need for capacity, capability strengthening, and development in this particular subject of SOGIESC inclusion. So that will require funding, that will require time and resources. But if organizations are able to make that effort, I think we could get to a place where more and more LGBTQI beneficiaries are able to access cash assistance as well as disaster assistance. One of the questions that I saw in the chat, and I think was very important, was what donors can do. And as I mentioned in my my presentation, donors need to push downstream partners. If it's working with governments, I know could offer some kind of conditionality about targeting, and also providing data about data of LGBTQI beneficiaries that they are providing assistance to, and then only then they can be able to do that. The other is, and for them to be able to even do that, they will need to work on building their the system, the processes, the policies, and so that is something I guess donor organization can also do, is provide training for some of their beneficiaries or grantees, and seek the support of LGBTQI organizations who are working in the humanitarian sector to provide that technical support and training. Thank you.
That's great. Thank you, Lagi. And thank you for answering that other question that was in the chat bar too. We might leave it there. We do have a few questions that we haven't had a chance to answer, but we will take those on notice and put some of the answers up on the website, the socialprotection.org website, when the webinar recording goes up too. So keep an eye out for that. I'd like to say a very, very big thank you to our wonderful panel tonight. We've had some really, really rich discussions here. Thank you to Emily, and thanks also to our sign language interpreters and our captioners and the socialprotection.org team for all their support in the background tonight. Remember to sign up for the socialprotection.org newsletter to keep updated about future webinars. And there's an interesting one coming up this week on Thursday, the 26th of August, which will be held at 8 a.m. GMT -4 time. And it's on leveraging the potential of safety nets to prevent gender-based violence. So keep an eye out for that one. When we finish up, there will be a post-webinar survey link put in the chat screen. We would really appreciate your feedback on the webinar, which could inspire further topics for us to discuss next time. It's really valuable for us to get your feedback, so we'd appreciate you filling that in, even though we know you've been on this webinar for quite some time now. And thank you so much for joining us, and we hope to see you again soon. Good night. Thank you.